My name is Dr. Solomon Oguta from Gulu University. Today, we are going to look at the future health risk of abortion. Besides the complication that abortion brings, there are also other future problems which are associated with abortion, which is very much important for us to understand. Firstly, abortion is associated with the future preterm delivery. Preterm delivery is equivalent to miscarriage, but it is the delivery of a baby before the 36 weeks of pregnancy. To explain more, before 36 weeks of pregnancy, the baby cannot survive on his or her own. So when you deliver the baby before the 36 weeks of pregnancy, this baby is under a great risk of so many conditions. And that one can also be caused by abortion. This one will come into the subsequent pregnancy. So when you carry out abortion today, remember that you are putting the subsequent pregnancies that you are going to have under a great risk of preterm deliveries. What brings about these preterm deliveries? First of all, it is the scarring of the uterus, which is brought about by the abortion. Also, weakness of the cervix. Every time you keep on doing the abortion using those instruments, you are weakening the cervix, causing cervical incompetence, which is going to compromise on your future pregnancy. Secondly, there is risk of breast cancer. Studies have shown that breast cancer is associated with the abortion. And generally, pregnancy is a protective measure to breast cancer. During pregnancy, especially the second half of pregnancy, there is differentiation of breast cells that is going to prepare the breast for maturation. When you carry out abortion early in the pregnancy, you are going to put the breast cells, especially the undifferentiated breast cells, into a risk of exposure to high content of the hormone, which is called estrogen. So exposure of estrogen to breast cells, to undifferentiated breast cells, it stimulates those breast cells to change into the cancerous states. That is how abortion is associated to breast cancer. So every time you carry out abortion, remember that you're putting yourself under a risk of acquiring breast cancer. Another problem is sexual transmitted diseases and pelvic inflammatory diseases. Some women do not show signs and symptoms of sexually transmitted diseases, yet it is present within the birth canal. For instance, chlamydial infection, some women may not show its signs and symptoms. So during the process of abortion, there is translocation of this chlamydial infection from the cervix or cervical region to up to the uterus. This will result into the pelvic inflammatory disease or infections around the fallopian tube. That is going to impact on the subsequent pregnancies. Another future risk is mental health. Abortion is associated with the increased mental illness in those particular ladies. These ladies may end up in regret, grief, guilt or shame, or some may have suicidal tendencies later in life. So, if you have had an abortion and you are experiencing those symptoms, it is important to call us or get in contact to any health professional that is going to link you up to experienced counselor that is going to help you. Abortion is also associated with infertility and future problem in childbearing. It is well known that abortion causes scarring of the uterus or sometimes may cause uterine perforation. All those may cause problem in future process of childbearing. And some ladies might have ended up not conceiving again because they carried out abortion in those previous pregnancies. So mothers, before thinking of doing an abortion, think about all these problems that you're going to have in the future. Because abortion may not only help you right now, but will put you under a great risk of future problems. And lastly, abortion will put you under a great risk of sexual dysfunction because of the damages that is going to put you under. Some women are experiencing sexual dysfunction not because of the infection that they're having right now, but because of the problem that they had in the previous abortion. So before doing an abortion, you need, first of all, to think of the immediate complication that you're going to have, and then also the future problems that you're putting yourself under. It will help you to make the rightful choice and decision. Thank you so much.